Hello, I am Cecilie Tenfjord Toftby, and I'm very honored to be able to address you today. As you see, you are here in the Swedish Parliament. I would hope that we one time can meet in person, but today I will show you a little bit from my working place, where I have been the last 6 years. I'm today the chairperson for the Committee on Trade and Industry in the Nordic Council. And I'm here today to talk about a very important issue, how we can develop our common interests at an international Nordic level. So, to my short brief to you. Thank you again for the opportunity to address you at the 7th Nordic in Helsinki. Although I'm not able to attend your meeting, I would like to send you my regards and wishes for a fruitful conference that brings value to Nordic healthcare and our societies. To many outsiders, the Nordic countries may appear to be a single unit. Our geographic location, our common history, and our far developed welfare systems mean that we have a lot in common. But at the same time, it is important to remember that we are different countries with different social conditions, especially when talking about Nordic cooperation. Through insight into our similarities and respect for each other's differences, we can achieve a lot together, not least at an international level. Our Nordic cooperation is important, partly to develop the Nordics and partly in order to speak with a strong, united voice in international forums, not least in the EU. Together we can create prosperity and competitiveness in the Nordics. It is important to work on a Nordic level in order to establish a coherent area where knowledge can flow freely over our Nordic national borders. Such an area would be international, attractive, inclusive for the outside world as well, and be a flagship project for our Nordic region. We are all battling the competition for talent and successful innovation brought on by globalization. Through a coherent knowledge area, we could create the preconditions to keep talents in the Nordics and at the same time attract new ones. A good climate for research and development of scientifically based knowledge is the foundation for prosperity and competitiveness. In several areas, there are currently parallel research projects in our countries. Sometimes knowingly, sometimes not. There is a great potential to increase the exchange of knowledge between our Nordic countries and also to develop common research projects. Drug addiction is a significant health issue in the Nordics as well as in all of Europe. Drugs do not care about national borders. They are being trafficked well out of sight, regardless of geographic area. We know that all Nordic countries are suffering from socio-economic problems following their citizens' alcohol and drug addiction, as we can see clear correlations between addiction, unemployment, crime, and other diseases, as well as high mortality rates. In the Nordics, we largely share each other's views of and values regarding alcohol and drug issues, as these problems have a clear welfare political dimension. Addiction causes great suffering for the individual as well as family and friends. Each year, the number of alcohol and drug-related deaths are as many as 2,500. And in counting only Sweden. It is important to recognize addiction as a disease. Patients suffering from addiction should have the right to treatment on a scientific ground. just as any other patients with any other diagnostics. Treatments should be based on science and evidence. Addiction creates a negative spiral where ill health leaves the individual more or less incapable of participating at the labor market. Not having a job makes it very hard to support oneself and keep your own household, which in turn creates an even greater exclusion from society. In addition to the self-esteem decreases alongside the mental health. In the addiction report Gerhard Larsen presented to the Swedish government in 2011, this correlation was highlighted. It is not unusual for the unemployed and those on sick leave to have problems with addiction. If we can help more people to get out of their addictions or live as a healthy life as a healthy life as possible, we create the possibility for more people to come back to the workforce, and at the same time as we are encouraging them to live their lives on the right side of the law and in community with the rest of the society. We know for a fact that approximately 70% of the clients in the prison and probation services have addiction problems, and that the most common crimes leading to prison sentences are addiction-related. Drug crimes, driving under the influence, acquisitive crimes, as well as violence are drug-related. In cases of violence, 8 out of 10 offenders are under the influence of alcohol and drugs. To illustrate an example of what kind of numbers we are dealing with here, the expenses of substance addiction in Sweden is estimated to cost approximately 66 billion kronor for alcohol and 62 billion kronor for narcotic drugs and 20 billion kronor for medical drugs. In total, the socio-economic costs in Sweden alone add up to 150 billion kronor on a yearly basis. These costs are 9 times higher than the resources which the municipalities and the county councils spend on healthcare, treatment and support to addicts. These numbers are Sweden only. And if we look at a Nordic level, the socio-economic costs would be much higher. It is incredibly important that we share the vision for the Nordic countries as a drug-free society. But in order to create the best policies, it is required that the decisions are made based on the latest scientific research to give access to the safest and most efficient treatment. In order to make those decisions, we need research to help us understand which actions are the most efficient and which investments are needed to decrease the drug-related damages and give the best treatment possible. We also need to increase the knowledge based on scientific research about drug effect, both the users and their surroundings. Maybe the most serious drug addiction is the one we find amongst our youth. Something has happened regarding the attitude towards drugs amongst young people, especially concerning cannabis. That it is not as dangerous as previously thought, and as well that they make a difference between different kinds of drugs. This change in attitude is highly concerning, and if we work together, we can make vigorous efforts to inform today's youth about the dangerous consequences of drugs. In order to know which treatment is the best to cure young people from addiction and to stop them from even getting addicted in the first place, we need treatment and healthcare ventures which are based on science. In that way, we can get the safest and most efficient treatment. This is an area where I think that all of us in the Nordic countries can work together to give the youth of today and tomorrow the same chance to a normal life with a job or studies, regardless of where in the Nordic region they live. The drug problems are a threat to our children's well-being in particular and to our societies in general. With the Nordic prosperity in mind, it is important that we decrease addiction and get more people back into society and the workforce. It is crucial to public health. In the government offices, the Ministry of Health and Social Affairs is responsible for ANDT, alcohol, narcotics, drugs and tobacco. It is responsible for ANDT policy coordination. As a part of the ANDT strategy, the National Institute for Public Health is also responsible for supporting ANDT coordinators at Sweden's county administrative boards. The boards, which have been tasked with the coordinating preventive work in the ANDT sphere on regional level, play a key role in the implementation of relevant parts of the ANDT strategy by linking efforts at local, regional and national level. Another important tool to ensure patients' rights to a scientific treatment is the National Board of Health and Welfare Guidelines, which emphasize the need for healthcare based on science and safe treatment. In this area, I can see that there are a lot of things we can do together to get our cooperation to work. A good starting point is to ensure that all of us in the Nordic countries consider drug abuse as a disease for the individual, its surroundings, as well as for the society in general. In this area, we can do a lot together. The addiction treatment does not look the same in all Nordic countries. It should be possible to learn from each other to provide a scientifically based treatment. Furthermore, common projects and studies generate comparable results in the healthcare system. Standardized thinking is necessary in order to make comparisons between countries and regions, and for knowledge to be collected, grown and exchanged. Today, each Nordic country measures and reports drug-related mortality differently. In the Nordic countries, if the Nordic countries would measure by the same parameters, it would be easier to compare the situations in the Nordic. Representatives from politics and academia must have clearer discussions regarding how we can develop the research on a Nordic level. For example, how can the results from the CIRAF's research in Oslo and UFOL's research in Uppsala be better linked together and applied to our regions? Via the Nordic Council, there is a strong support to develop the Nordic research, such as supporting cooperation between national and Nordic research funding bodies on flexible interactions between research funding, research funding, research priorities, and research infrastructure. Supporting joint Nordic initiatives in research infrastructure. Removing obstacles to freedom of movement for students, researchers, and knowledge in the region. If we make a common effort in research areas of importance for the Nordic prosperity and competitiveness, we can create a better living. By giving care and treatment based on scientific knowledge, we can provide our citizens with the safest and most efficient treatments. We all have a great responsibility for this. Politicians, such as myself, academics, and society at large. By talking about the damaging effects, we can together prevent future addiction. To ensure patients' rights to treatment by recognizing addiction as a disease and providing scientific health care, we will take important steps forward. The worst thing we can do is to deny these problems. There is time to take action and benefit from a Nordic collaboration using existing resources to make patients' lives better. It is time to reach out, to bring the Nordic countries closer to each other, to increase knowledge in healthcare and provide addiction patients access to safe treatment. To improve dialogue and common tools between the Nordic countries, it is a very important step. Thank you for listening. I wish you all the best in your work to improve Nordic healthcare and patients' right to safe and scientific treatment. We need it, our children need it, our future need it, the Nordic countries need it. Thank you very much and good luck.